Hello, welcome to the spring semester at Saddleback College. This webinar series for spring is Career Paths and a Social Awareness for the Dancer. I'm Donna Shanti Harter Johnson, and I will be taking you through a series of careers in dance and really focusing in on those careers. We started to look at what are some aspects to these careers in the fall semester, but we're going to delve a little bit deeper this semester into what it takes to be a particular thing in dance, or what educational expertise do you need to have in order to get to be on that career path. What schools might be a really solid choice for that particular career path. The first webinar we're going to discuss for careers in dance is being a physical therapist. When you are a physical therapist, you are looking at different aspects of relating to a patient. So you might create physical therapy treatment plans to improve or possibly to restore a patient's mobility. Also, you're looking to reduce pain. You're going to continually reassess the resource utilization for that particular patient and looking at how their progress is moving towards their goals. You're going to test and measure the patient's strength, their range of motion, and their muscle performance. You're going to examine a patient's medical history, and you're also looking at giving them goals both on their own as well as in a setting where you are meeting with that patient. So we had a wonderful opportunity to interview Vanessa Figueroa, who is a physical therapist in San Diego with the Sharp Medical Center. She has been working in physical therapy for several years now, and I would love for you just to get a little sense of what it's like to be a physical therapist and hear a little bit about what she does. So thanks for joining us today on this webinar about careers in dance. I know that you're a physical therapist, but I also know that you have some dance background, and I'd love to hear a little bit about that. Would you tell us a little bit about your job and sort of what it is, what it entails?
Yeah. So I'm a physical therapist. I work in a hospital-based outpatient setting. So that means we're connected to a hospital. And I do orthopedics. So that means people that have shoulder pain or have had shoulder surgery. That can be neck surgery or neck pain. I see patients that have hip pain, back pain, knee pain, ankle pain, foot pain, pretty much the entire body. And a few ago, I also started doing women's health. So I also help women who may be dealing with incontinence issues that may be connected to pregnancy or childbirth. And so those are my, that's sort of my passion project. I love working with women, especially postpartum. So that's kind of what I focus on. So it's really, I get to work with the whole body, which is really fun and really exciting.
What was your background in dance before entering this particular career?
So I pretty much danced all my life, probably like, a lot of other people in the world, starting really young, like at 3 years old with ballet and tap classes. And so I just danced through high school, mainly ballet. I went to UC Irvine and actually majored in dance and minored in history. And I think my plan was just to probably dance. I don't think I really had a plan after that. After I graduated from college, I did a lot of small little things. I did some musical theater. I danced in a couple of operas. I danced for some smaller modern dance companies in the San Diego, Orange County, LA area. And I was just kind of this free spirit, bouncing around, dancing, performing. I also was a substitute teacher to help supplement my income. So I just was kind of bouncing around doing a bunch of different things. And so then what I did is I started to get into massage. So I went and got my massage certification, and I did a focus on traditional Chinese medicine, and I started doing that as well. So I was dancing and doing massage. I had my own business. I would go to people's homes. I was also working in an acupuncture clinic. So I was kind of same thing, free spirit, doing all these different things. And then as I was doing this, I was thinking, I don't know if I'm going to be able to do this forever. If I'm going to be able to do little shows, little gigs here and there, and then doing massage. And I kind of wanted something more. What was the next thing that I was going to do? And so I was thinking about this, and physical therapy just kind of, popped into my brain. I can't say it was something specific that happened. I didn't go to physical therapy. I didn't know someone that was a physical therapist. I just got geared towards that. I don't really know how that happened. And so then I started doing observation hours and just really fell in love with this field. And physical therapists are movement specialists. We really look at the way people move and make sure they're doing it correctly. Just sitting, your posture, the way you do lunges, the way you do squats, the way you walk, everything that you do. That's what we focus on. And I think that's what dancers are too. Dancers are movement specialists. And we're really good at looking at how people move and going, oh, my arm should be like this, my pelvis should be here, my head should be here. We're so specific. And we've been trained to be that way, I think, our whole lives, if you've been dancing your whole life. So I think they really, really went hand in hand. And so from there, I started working towards physical therapy. We could talk more about how I got there as far as schooling, but I started with dance, and then it kind of molded into massage therapy, dance, and then it kind of morphed into physical therapy. But the journey was very long to get to PT school. It was not as smooth as that movement I just did with my hands.
Now, you had said that you were wondering if you could continue doing this. Was it because of thinking about physically? Were you going, oh, will I be able to do this with my whole life because of the physical demands? Or was it more like financially, or any of those kinds of things that made you feel that way?
I think it was more financial, because during this time when I was dancing and massaging and doing all these, I basically had like 10 jobs. I was in my early 30s, which is really young. So I wasn't having too many physical ailments. I wasn't noticing that stress on my body. But eventually I think that would have been an issue as well. But you know what? I take that back. I would say, there were some days I was doing maybe 6 to 8 massages a day, and that was tough on the body, almost more than dance, just massaging that many people. So I think there was a physical standpoint, but it was almost more a financial one, in the sense that, gosh, I don't think I can be financially stable and independent if I just keep doing what I'm doing. And also, I'm just not a great business person. I had a hard time charging people probably what I should have charged them for massages. I was going to their house and staying at my table, and that would take 2 to 3 hours sometimes, if you think of like the massage, the driving there, setting up the table, the massage, the whole thing. And I was making okay money, but not great money. I think if I was more of a business person and I was better at, being aware of how much things should cost, maybe I would have been doing a little bit better financially. But I think the big push was financial.
So what was your education just in general? And then what kind of education was particularly special for this part of your career?
Yeah. So my undergraduate degree is in dance, and I minored in history. And so after I graduated, I didn't go to school for a while. I was just, like we said before, I was just kind of dancing and just doing all these random different jobs. And I did get my massage certification from an acupuncture school in San Diego. And so then I was massaging for a while. And then once I kind of, came to this place where I decided I want to do physical therapy, I looked into what you had to do to get into physical therapy school. And it's a doctorate program. It's a master's that transitions into a doctorate program. And the requirements were unbelievable. And as a dance and history, graduating with a dance major and history minor, I had none of the requirements. So most people that do physical therapy often have had a actual pre-physical therapy degree, or biology, or or kinesiology or things like that. So the requirements were, anatomy, physiology, of course, a year of chemistry, a year of biology, calculus. I mean, the list goes on. I can't even remember it all. And since I had such a more of an artistic degree, I didn't have any of these classes. So the first time I looked at it, actually, to be honest with you, I was very discouraged, and I decided, well, I'm not going to do it. That's impossible. I can't do that. And then, I kind of marinated on that for a while and realized, no, you want to do this, you just got to do it. So I took all my prerequisites at the community colleges in San Diego, and the community colleges here are fantastic, and I had some really amazing teachers. So I'm grateful for that very affordable education to help me get into PT school. And I had to start with pre-algebra. I had to start like really at the bottom. I think I was starting with maybe like ninth grade math. I just didn't have any of these classes. So it actually took me 3 years at the community colleges here in San Diego to get all my prerequisites to just even apply to physical therapy school. Because I already had an undergraduate degree, so I was good there, but I didn't have any of the courses required. So that took me 3 years. Plus you have to take the GRE. So I took a course so that I could get a decent score on that so I could get into school. And so once I had all the prereqs, did all the application, took the GRE, I was able to apply to physical therapy school, which I said is a master's to a doctorate program. So it's a 3-year program. And so I got into school, really exciting. And so then I had 3 more years of school, actual PT school. And I went to UC San Francisco and the SFSU program. So it's a joint program between the UC and the state system. A great program. I am so grateful I got into that program. Also amazing teachers, an amazing experience, amazing colleagues that I have now that were my classmates. So I was really grateful for that as well. So I had a great experience there. So then finally I graduated from PT school. And then right when I graduated, you take a board exam, which was very stressful, and it's a couple hours long, but that went well too, fortunately. And then pretty much right after school, right after I took my boards, I started working. And I still am learning. I'm still a student. We through my work, we have to do 32 hours of continuing education every year. So I'm always taking courses. Of course, because of COVID, the courses are not in person right now, but I do a lot of online courses. So I will be a student forever. This field is so interesting. There's never been a single moment in my career where I've thought to myself, well, I know everything. I've got it now. I've never felt that way. I'm always learning. I'm always discovering something new. I always will have a patient that is a head scratcher that puzzles me, that I have to do some research. I have to look at articles. I have to find something, different for that patient. So that's my pathway to get into being a physical therapist. And like I said, I'm still learning. I'm still a student. I will forever be a student because this field is so interesting. There's always something new to learn.
Oh, yeah. Um, so the 3 years at community college, was that because you were doing full-time 3 years worth of stuff, or was it because you're also working? What took it 3 years to get those credits?
I would say it was a combination of both, because I was, working and supporting myself, and so I couldn't take maybe a full load. But there were times there where I was taking quite a few classes. Like I think there was times where I was taking, and I don't remember the units, gosh, it's been so long, where I was taking, I think, biology, chemistry, and like microbiome or something like that. So I was probably taking three classes at a time. So I had a pretty decent load. It really comes down to, is just I was basically starting from scratch. It's almost like I had to get another undergraduate degree, because the undergraduate degree I had didn't wasn't going to help me get into PT school. I think it totally helped who I am and probably made me a more interesting candidate. And I think it probably helped me get into school. But I didn't have any of, the requirements. So I think there was just so many classes.
The educational requirements to be a physical therapist are you need a bachelor's degree. And although you don't have to specialize in looking at a physical therapy undergraduate, it can be helpful. And generally, you want to be thinking about certain general ed requirements are going to be necessary for continuing in the path to the degree for a physical therapist. So the needed prerequisites in order to go into a doctoral program for physical therapy are you're going to need biology, chemistry, physics, human anatomy, human physiology. You might need abnormal or developmental psychology. It is likely that you'll also need statistics. Some schools may also require calculus and exercise physiology. The schools that you look for in physical therapy generally aren't ranked. And so, most often, as long as you're going to an accredited program, then they will be teaching you everything you would need to know because all US states require that physical therapies be licensed, and you all have to take the specific exam, the National Physical Therapy Exam. So, most school programs that are specific to physical therapy are going to be training you and working toward passing that exam. So, generally, anyone who is accredited, it's going to be a great school, it's going to be a great choice. Some schools do focus on a specialty already within that school, and so that may be something you want to start looking at. But generally, again, you can also do this in continuing education, which you do need to do in order to maintain your license. So even if you didn't go to a program that had a specialty, it is possible to still do that within the continuing education that you will need to receive anyway. Some of the schools that were recommended these were some of the schools that the people that I discussed this with, they looked into. And again, they really, really emphasized really any school is a great school. Getting your general education and your prerequisites can be done at any community college. Also could be done at a four-year university as well. So as long as you're thinking in those lines, then you're ready to go. And then the ones that are specifically about physical therapy and the doctoral program for that, it's much more about maybe where do you want to live or what kind of clinicals you would like to have or what you would like to be exposed to. But for the most part, any good accredited school is going to be perfect. So some of the choices of schools that my participants looked at were at UC San Francisco. It's a joint program with San Francisco State University. And what they have available to them are the Doctor of Physical Therapy, a Rehabilitation Science PhD, an Orthopedic Physical Therapy residency, or an Acute Care Physical Therapy residency. Also, New York University has degrees available there. They have a Master's of Pathokinesiology, a Doctor of Physical Therapy, a Doctor of Physical Therapy for practicing physical therapists, meaning if you already are practicing physical therapy, this is also how you can do your continuing education. It has a clinical residency in orthopedic physical therapy. They have a PhD in physical therapy research, and they have a physical therapy PhD in rehabilitation sciences. I've listed on here the number to call or where it's located. I've also listed the website if you're interested in going to these particular school websites. Some other great schools to choose from, again, this is just based on what these people looked into, is the University of St. Augustine, The University of St. Augustine is an interesting program because it has multiple locations. It's not just in Florida, it is also in Texas, it's in California. And so many of these you can have a program that's closer to you. The degrees that are available for there are a doctor of physical therapy, similar to the other two. This one can be either a residential or a flex, meaning that you can work in a hybrid setting, so you can do it from afar. A doctor of occupational therapy, also the residential and or flex. A master of occupational therapy, which is a residential or flex. A transitional doctor of physical therapy, and a post-professional doctor of occupational therapy. Those are the different things that are available at St. Augustine. And also Boston University. They have a bachelor's of science in health studies plus a doctor of physical therapy. This one is a 6-year accelerated program. So it is both your bachelor's as well as your DPT, which is what you would need to be as a physical therapist. So this can be an accelerated program you can finish faster in a whole general idea if you have some of your prerequisites out of the way already because of being in a community college. That can probably help also. They also have the doctor of PT, and they have a combined doctor of PT and a PhD in rehabilitation sciences. So with the Boston University one, that's an interesting one because they combine a number of the programs so that you're getting essentially a couple of things at the same time, which may be a great option if you're really focused on being a physical therapist. You really know that that's the path you want to take, and you may want to consider that to help move that forward. What was the education for you for massage therapy? Just in terms of if someone was, since you really kind of have done several careers as far as
Yeah.
someone can be a massage therapist, especially
Yes.
as you're talking about it being very much a part of what dance is,
Hmm.
and then PT having led from that. What kind of education did you need to have for the massage therapy part of your
Yeah.
life path?
Yeah. Yeah. So my massage training or education was really fun because I went to an acupuncture school here in San Diego. So we did a really neat a focus on traditional Chinese medicine. So we did anatomy and physiology, although because it's more, it's not, I couldn't use the anatomy and phys that I took at massage school because it wasn't and I'm not going to use the right term here, but it had to be from a community college or from a university for it to count for my PT school. And the anatomy and the physiology class I took at massage school was fantastic. I mean, it was really great. So I did those courses. Of course, we learned all the acupuncture points and we were tested on those. I don't remember them all anymore. It's been so long. And we did a bunch of massage courses, basically. So like your Swedish massage, Tuina, which is more like a traditional Chinese type of massage. So it was a lot of hands-on, but a lot of didactic, things as well. And that's, I think I did 650 hours. So, gosh, I think I was in school even for massage for maybe a year and a half or so. And the cool thing is once you reach a certain number of hours, I think it's around 200 or 250, you can start working as a massage therapist. But I did longer schooling to have that emphasis, like I said, on traditional Chinese medicine. So it was a lot of really interesting classes.
Do you feel like even though the anatomy and physiology didn't transfer to your PT education, do you feel like it was helpful to have revisited those?
Yes, absolutely. The body is so intricate and amazing and beautiful. I mean, you could take an anatomy class every day for the rest of your life, probably. I mean, it just you could always delve into it deeper. You can always review it. Even now, even now when I'm working with a patient and I'm thinking, gosh, I'm missing something, and I'll still pull out my netter, which is if anyone wants to get an amazing anatomy reference, get a netter. It's the best. And ETTER. And he just has these beautiful drawings of the human body and like the nerves and circulatory system and everything. And I still look at that. I mean, probably, a few times a week, I still pull out my netter, or I still, get on the internet and look at pictures of anatomy, because you could constantly be learning about it. And I'm one of those people. I wish I had a photographic memory, but I don't. I am one of those people that I have to study a lot. I have to review things constantly. I don't remember things the way some other people do. And so I'm always looking at stuff again. I'm always reviewing it. I'm always discussing things with my colleagues. So yes, anatomy forever. Forever.
But actually also, was it easier to understand where the muscles were and those kinds of things because of dance? I mean, I know not necessarily having learned the proper names or like
Yeah.
exactly where things are, but was it something that you feel like, oh, I think I understand where that is because I think I felt that? Or, I mean, was there anything that helped connect it us again because of dance versus because of even just having had it beforehand?
Oh, absolutely. That's a great question. I think my dance background, my movement background really helped me. It still helps me now, because I grew up, you know, yes, I'm a dancer, but I feel like, I'm a mover. If you think of it like really organically, like I love to move, and I understand. I know what it's like to be in my body, because I've spent so much of my life, I mean, really more of my life being a dancer than anything else I've done, even though unfortunately I don't really dance anymore because I'm too busy. But that's inherent in me of being a mover. So I understand movement. And there were lots of times that, because we had so much stuff to memorize for school, I would do a dance to remember it. I would, to remember what a certain muscle did. I'd be like, okay, so that muscle helps you do arabesque, and then this one helps you do this. And I would always bring it back to dance for sure. And I feel, also just like looking at patients, of course I taught dance for years too. So I see, everything. I know what they're doing. I know what they're moving. So I think even though it took me a long time to get to this point, I wouldn't change anything, because I think for me, I'm a better physical therapist because of that dance background, because of that mover background, because just like you said, I really understand the body, because I've spent so much time, in it and moving it and being around other people and moving other people, especially when I, got more into modern, and we're doing a lot of partnering and lifting and, very organic movement where you're really entwined with someone. And so you just understand the body so much more.
Do you feel like you're able to I know that you have done a couple of little things dance wise. Do you think that PT has helped you understand dance better?
Mm, that's a good question. I think it's I think sometimes I look back on things I did as a dancer and kind of think, that wasn't so good for my body. I probably shouldn't have been doing that. So I almost think it's kind of done the opposite, where I'll look back and go, ooh, I shouldn't have been like, cranking my leg, behind my head and pushing into the posterior part of my hip capsule. Like just all these like things that we did. So yeah, I haven't, I think maybe what it is it's, and also because I'm older, but if I had taken class like maybe 3 or 4 times in the past, I don't know, 5 or 6 years, barely. But then when I'm in class, I do look at things differently. Like I'm not so concerned about my turnout or how something looks. I'm really trying to do everything really correctly, and respect my body and respect the boundaries of my body. But also that comes with the fact that I'm not performing, and no one is looking at me. So I can just do things the way they are, so that they feel good and that I'm doing them correctly and I'm not injuring anything. But that that comes with the fact that, like I said, I'm not performing. I don't have to look a certain way, because no one cares what I look like when on the rare occasion I take class. Then it kind of also makes me think of like when I talk to dancers or work with dancers, and they may have limitations in their genetics, in the sense that they don't have the turnout that they want, but they need to have it to be on stage or to look a certain way. And, maybe a few years ago when I first started, I would be like, you can't do that. Like you can't force it because that's just not right. And now I've kind of morphed into this place where humans do things that maybe humans were not designed to do. Like if you look at gymnastics or a lot of sports, people are doing things that are amazing and probably aren't the best thing for their body, but I feel part of my job would be to find a way for them to do it as safely and as correctly as possible. Because if you're passionate about something and you really want to do it, you're going to do it. So you might as well try and do it as safely as possible. So, like, maybe an example is, someone that really wants to run a half marathon and they really don't have the mechanics, for it. They might not have, the best, lower extremity mechanics for running, just genetically. But it's my job as a physical therapist to make them as strong as possible and to give them as many pointers as possible. Because if they really want to run this marathon, even if maybe they don't have the best body for running, I want to help them get there. So I think I've kind of transitioned from where I was when I first became a physical therapist, and I was like, well, no one should have their leg behind their back, all the way up here, and really shouldn't do that because humans weren't designed to do that. You know what I mean? We're supposed to like run and walk and squat and do different movements. Were we supposed to have our leg behind our head? Probably not. But they're passionate about that. They're a dancer. They want to be able to do that. So we have to find a way where they can do that. So yes, I think it is such a dance between dance and movement and physical therapy and the anatomy and the physiology and all those things, and finding ways to do what we love but preserving our body and being as safe as possible.
There are lots of different places that employ physical therapists. It's not just at a hospital or a specific clinic. There are many, many places that you could be employed as a physical therapist. You could be in a private physical therapy practice or clinic. You can also be a part of a hospital, both acute care and subacute care. You might be employed in a community health center or an industrial health center. You could be employed in a sports facility. You could also be employed in a nursing home or a rehabilitation center. You also might be employed through a home health agency. There are a way of being employed through schools or pediatric centers. Also, you may want to go into using a physical therapy degree in a research institution or also teaching in a college or a university. Some specializations that are present within physical therapy is you could be within the orthopedic specialty of PT. It could be in neurological. It can be in pediatric. It could be in geriatric. There really isn't a specific dance specialization, but there is a performing arts medical certificate. When you are thinking about using dance in physical therapy, it's possible that you could be employed within a dance company and you're the physical therapist for that particular organization, and you're working specifically with performers to both improve their performance as well as rehabilitation if there is an injury. There are many people who work within professional organizations in that capacity, but there isn't a specific dance specialization. Similar occupations are an athletic trainer or an occupational therapist or also a chiropractor. It's someone who is specializing in working with the body and finding a way to make sure that the body is functioning at its most optimal. So some of the benefits of physical therapy are that it can decrease or eliminate pain. It can also improve coordination, balance, and muscle strength. It can improve your breathing, your cardiovascular functioning, and your endurance. It can promote wound healing. It restores normal movement for standing, walking, and running. It can augment effective recovery from surgery or major illnesses or disabilities. And it can also provide an alternative to surgery. Not always do you need surgery that might be able to be accommodated with a physical therapist or prescription drugs. It can prevent injuries and it optimizes physical activity and sport performance. In dance, clearly, this is an important element to it because you want to be able to maximize what you're doing as a performer. And so, a physical therapist can help you or can help the performer optimize what their abilities are, what the capacity is, and their endurance for that particular length of time. It can reduce swelling and inflammation of your joints. So there are several benefits to physical therapy. And as someone who is interested in helping others, someone who's good at listening and also relating information to a patient, you're in a perfect environment to become a physical therapist. What do you think a student could do to understand how to best do the things that they want to do as far as stuff, but also protecting their body? I mean, apart
Yeah.
from taking a specific class about like dance injury prevention or
Yeah.
those kinds of things, is there something that they could do easily to help them
Yeah.
both with the longevity of their own chosen career as well as just protecting their body to make sure that injuries don't happen?
Yeah. I mean, I think a lot of things that teachers already tell dancers to do, trying to get, I think the biggest thing is like, trying to get your foot position from your hips, like really trying to rotate from your hips versus at your knees or something like that, or even at the ankles to get more of that, turnout is like a classic one. I would say a big one is doing a really good warm up even before just class. Um, and I'm guilty of that. Like, when you're young, everything feels great and everything works great. So before class, you just like sit in your middle splits and just like hang out there, with your with your elbows on the floor, right? And talk to your friends, and then you're warmed up. Like, let's do some petit allegro, no problem. So the biggest thing I would say is before class and before rehearsal, you want to do a dynamic warm up, which means like faster movement. So you don't want to do your prolonged stretching before your activity. And I think a lot of teachers are already changing that in the sense that a lot of classes start with leg swings, right? Like at the bar. Like I've seen a lot of classes start with leg swings at the bar or just like tendus, like a little quick tendu combination at the bar before you start right into plies. And I think that's a great way to start class. Don't start class or rehearsal by hanging out in your splits for 30 to 60 seconds or longer. And the reason is before I do a dynamic activity, like a dance class, like a rehearsal, I don't want my muscles and, my tendons and everything to kind of be stretched out. I want everything to be nice. And I don't know if tight's the right word, but I want everything to be a little bit tighter. I'm not going to elongate everything and stretch everything out and then go do a bunch of jumps. You know what I mean? Because that makes me more prone to injury. But someone may say, well, we're going to do grand allegro and I want my, jeté to be like in a splits. I'm like, great. Then do some leg swings. You know what I mean? Do like some quick movements. Don't hang out in your splits for a minute or something. You could do your splits really quick and hold it for a few seconds and then get out of it. But you don't want to just like be hanging in those stretch positions. So always warming up before class, always warming up before rehearsal. And we all know what a real warm up is. So, and I do this all the time. Like before rehearsal, I would maybe do like 5 push-ups and like, do my splits, right? And then you're like, okay, great, I'm good to go. And for the most part, you are fine because you're young and you're healthy, but you want to take good care of yourself. So you want to do like a good warm up. So a lot of that is a commitment to yourself to getting to your rehearsal space or that place early, getting there early so you have time to do that. Another thing I would say is trying to be as symmetrical as possible. So let's say you're in this piece where you just do a ton of stuff on your right leg, like just whatever it is, like arabesque or jumps or turns or whatever. I mean, it would be great after rehearsal to do some on the left side, right? Um, so, for example, if you have someone who plays soccer and they always kick with their right leg, or same with football, they kick with their main leg and it probably goes up, like their leg goes really high. Then afterwards, I would do a couple on the left side just to kind of like make sure that you're evening that out. So I would stick with really good warm up, thinking about symmetry in the sense that I want to try and counteract what I'm doing. If I do everything on the right side, do a couple on the left side. And then just having some grace with yourself in the sense that, like, if your turnout is here, is it really worth that extra centimeter if it's coming from your knees? It's probably not. Now, maybe during rehearsal performance, you're going to push it a little bit more, but in class, you really want to think about, I think, being as true to the anatomy as you possibly can, if that makes sense.
Yeah, that's great. Especially the symmetry one. I think I don't necessarily always think about that, but I can totally understand how that's important. I mean, as I teach now, I make sure
Yeah.
that even though I'm not doing every single combination side by side, but I try to, like, okay, I do my plies on this side and then I try to do my tandies on this side and then my other tandies, so that at least I'm evening it out, because I totally understand how quickly, when you only demonstrate something on one side, that it's just like a mess.
It's yeah, it's crazy. Yeah. And we live in such an asymmetrical world. So, like, a lot of us are right-handed. So you're always, doing certain things with the right hand, or you always have your purse on the same side. Or for, people that work in an office, they may have a file cabinet on their right side. So they're rotating to the right. I mean, they may have the same job for like 15 or 20 years, right? So then imagine like rotating to the right for 15 or 20 years. Like, what's that going to do to the spine, after a while? So same with dance. Like, if you just like you said, I mean, especially people who maybe are in a dance company and they have a signature piece and they do that piece at every performance, and there's like a certain move they always do, like one way. Or my people that are in Broadway shows, I mean, they are really probably just doing something potentially just on one side. Well, after the show, it'd be great. Okay, I'm just going to do like 10 grand mas on my left side. I'm just going to even it out a little bit. I'm just going to do like a couple pirouettes on my left side, because you can get so asymmetrical. And like, what does that do to the body? Like, even just like if I do a certain thing on one side, how much more flexible is that going to make that leg? And how much stronger is the opposite glute? And how does that impact everything else I want to do, on the other side? So just, yeah, it's really interesting if you think of it that way.
How do you, in terms of, so you talked about a warm up. How do you feel in terms of like a cool down process, or like when is a good time to stretch, or any of those things that as a dancer you want to do, but it's like, when do you fit it in, or how do you manage it?
Yeah, that's a great question. So I would say, let's say after class and you don't have any more dancing to do, so you're pretty much done for the day, I would do your prolonged stretching at that time. So whenever you're done with dance for the day or for a long period of time. So, like, for example, let's say you took class and you don't have rehearsal or performance until hours later, you can definitely do your prolonged stretching, like doing your splits, doing your cool down, like just gentle kind of like range of motion type of things. Like, it might be just, like ankle circles and maybe a couple like rond de jambes, like, cool it down, go ahead and do some stretches. It might be great after class when you're warm, lay on the ground, do some core work. That makes me think of like your Pilates, like your 100, or, anything like that. So I would say after class is a really great time to stretch if you're not going immediately into rehearsal. If you're going immediately into rehearsal, it might be great after class to do like some core work and then have a snack or something, right? And then after rehearsal or after your performance, then you would do a cool down.
Um, how has COVID-19 affected your job? And what do you see? Is there anything that you see changing in the future, or do you think that there's anything that's been positive that's come out of it that's made you think about a different way of approaching your career, or the way that you approach how you're working?
That's a good question. That's a tough question. Yeah, COVID has changed a lot. I mean, for everyone, for everything, right? When it first happened, I think for all of us, we didn't know that much about it. We didn't really know, I don't think, how it was transmitted. We didn't really know what we should do. So my clinic, we never shut down. We stayed open, but what we did is we really minimized um, our hours and how many people we were seeing. So what we did is all the therapists, most of us work between, 25 and 40 hours a week, and we all cut down to maybe 6 to 8 hours a week. And we were only seeing patients that had just had surgery that were post-op. So you want to think of someone that just had a total knee, they had just had, basically a joint replacement, maybe rotator cuff repair, something like that. So they just had surgery. So they really needed to come in. So we were seeing only those patients, and also patients that were in so much pain that they might go to the emergency room. And people often go to the emergency room for back pain or hip pain, something so severe, they go to the emergency room. And so if we wanted to make sure that we weren't sending any of patients that might be coming to us, we didn't want them going to the emergency room or urgent care and taking up space there when we knew that we could help them. So we were seeing very few patients initially. And then uh, after the first few weeks, once people started being more specific on mask mandates, and we had clear instructions on what to do about that. So now all of our patients come in with a mask. They can bring their own surgical or cloth mask. If their mask is not fitting them well, we will give them a surgical mask. We wear surgical masks at all times, and we also wear a shield. So I have like these glasses, and I have a shield over my whole face. We have symptom checks coming in for patients and employees, of course. So they run you through the symptoms to see if you have any symptoms. And our clinic has always been really good about cleaning, but I would say even more diligent. So, just cleaning everything, like doorknobs, the goniometers that we use, our pens. I mean, just literally sanitizing everything. We do fresh pillowcases, and on every single patient, of course. We even have separate pens that have been touched and pens that have not been touched, so literally just sanitizing everything, our keyboards, I mean, everything. I would say it has been difficult to, because I'm such a people person, it is weird to not see people's faces. And I'm realizing how much communication, and I mean, we know this, how much communication is visual. So now that I have, my whole face is covered, plus I have the shield, especially for my patients that maybe are hard of hearing, it's hard for them to understand me sometimes. And you don't realize how much you understand from someone, by kind of looking at their mouth and seeing what they say, and how much communication is, like I said, is just body language, is visual. So there's a little bit of a communication barrier that I've noticed, although it's been fine. What else? And now that we have clear understanding about the virus, and I know we don't know everything, but we know, I think, pretty well how to prevent it. Most of us are working at our full schedules now, and we are seeing patients, of course. And there's been some patients that don't want to come in, and we completely respect that. We are doing telehealth. So it basically would be a visit like what you and I are doing right now, where we're chatting and almost doing like a Zoom or a FaceTime. So we have that offered to patients as well. And people, I think, are feeling more comfortable in the sense that not that they're not worried about COVID, but they know what we're doing. They know that we're a mask, that we have shields on. They're going to wear a mask too. And even though I'm still very close to people, I'm definitely, within 6 feet. We have so much PPE on that I actually feel very safe at work. For our front desk staff, that they have the plexiglass like you might see at the grocery store or other doctors' offices. As a staff, we have an office where we're all together and we do our documentation, and usually we would eat and spend time together back there. And so another great thing that we're doing is we're not eating inside the clinic anymore. So for us to eat, we actually go outside to eat. So we eat outside now. So essentially, we are allowed to take our mask off just to get like a sip of water, but I have a mask on the entire time. And then when I'm with patients, I have a shield on the entire time. So I feel that we're doing a great job at work and it feels very safe. How is this going to change things for the future? Yeah, that's a great question. And I don't know. I think it's possible. I think in the healthcare field, we might be, I don't know if we're going to be wearing a mask for the next year or so. I mean, sorry, I don't know if we're going to be wearing a shield, for a long time. I think it's possible that healthcare workers, even that are not, in surgery or something like that, we may be wearing a mask for a very long time, potentially even after there is, a safe vaccine. So I wouldn't be surprised if a year from now that I'm still wearing a surgical mask, and I'm fine with that. I think, and maybe during cold and flu season, maybe we'll always have people wear masks just to kind of prevent that transmission between people. I think, like, more and just like a bigger perspective, it's just made me so grateful of how easy things were before COVID, and I didn't realize it, right? I didn't realize I didn't realize how nice it was to kind of sit back, during a break and have a snack and chat with my coworkers, how easy it was to connect with people and see their faces and see that, oh wait, that movement is hurting them and this is going on. So I think for me, in like a bigger picture, it's made me grateful for what I had and looking forward to that time, which I know will come eventually. I don't know when it's going to come, where we sort of get back to a little bit more of a semblance of normal, whatever that might be, but at least, where we're not so worried about getting each other sick. And I hope that comes soon. I'm hoping it's within 2 years, year and a half, 2 years. So yeah.
Do you feel like any of the telecommuting it has made anything easier in terms of reaching certain patients that maybe fall off the grid or like are harder to keep up with? Or I mean, and do you feel like that's something that might potentially continue, or do you feel like that's something that's just like so impossible that it's just like, that's only good for right now and we've got to stop that at some point very soon?
I think that the one positive is that it kind of pushed us to start doing telehealth, which we weren't doing before at my clinic. And so I think we're definitely going to keep it. We're not seeing a ton of people through telehealth. Most of our patients like to come in, and I think we can, for the most part, provide better care in person. But yeah, we're definitely going to keep it. I think it's been really helpful. I had a patient that was a mom and she needed to be home to take care of her son. And I think it was really great for her. And she had a great setup, like the way she set up her camera and everything. So I could see her really well. And I felt like that was really productive. There are some patients I think that need more hands-on work and need to do better in person. So I think it's better for some patients definitely to come in. So I would say I didn't use it a ton, but I think it was very helpful for those few patients that probably didn't want to come in or were nervous about COVID. Understand. So it's something that we're definitely going to keep. We'll probably always have it now, and I think it's a great option for patients.
Yeah, I think that's the interesting thing about just in general is, how do we use these things to help move forward, propel forward, not just go like, oh, this is a horrible thing to have to do right now, but instead of going like, hey, well, what are the opportunities in this moment in time, and see how these things can change for the better with certain things that we're being forced to deal with.
Yeah. I mean, kind of going off of that too is I just remember, I teach this fourth trimester lecture. I teach this lecture once a month that's geared towards new moms and talking to them about what's happening to their bodies during pregnancy and childbirth, and specifically, really after you deliver, whether it's a cesarean or a vaginal delivery, things you can do to really maximize your recovery. And I've actually had more people take the course since COVID because we're doing it like this format. We're doing it over Zoom. And you can imagine if you're a mom who either, you might be like 36, 37 weeks pregnant, and you could have another kiddo at home. It's much easier for you to take the class via Zoom versus I used to teach it, at my workplace. In a classroom type of setting, and we would do it Tuesday nights, pretty late. We would do it Tuesday nights because I was doing it after work. But now since I've been home, I found a way to do it Saturday morning. So that class actually, although I really like doing things in person, this is not my preferred form. It's like talking to people like this. I don't like this as much. I like to do things in person. So I love teaching the class in person, but the cool thing is I've had more people coming to the class doing it like this, doing it via Zoom. And so I've been able to reach more people that way. So, that I was just kind of thinking about that when you were talking, that, that was great because now more people are actually taking the class. So it has been, a benefit.
So some additional resources that you may be able to look into for just more information about physical therapy. One of the resources that I have, and someone that I know personally who is a physical therapist, has a fantastic website that is specifically about dance. It's Dance Prehab. They're elevating the artist and athlete. So what they are doing is that they are aiming for looking at how physical therapy can help specifically dancers and dance performers. You can also look into the American Physical Therapy Association. They have a lot of information about physical therapists, what it's like to be one, what kind of places you may work, several of the places that you can get the exam, and any other information you may want to have about physical therapy. Also, Explore Health Careers does exactly the same thing. It gives lots of information about being a physical therapist. It also goes a little bit more in depth into being an occupational therapist or an athletic trainer or a chiropractor. So any of those other things we kind of touched upon, but that it goes a little bit more in depth into that particular career.
I guess like a big thing is just, I don't know, dancers, movers, I think are just we're such a we're great people. You know what I mean? And I'm biased, of course, but I just think of all my dance experiences and all the people that I've been around, and dancers, singers, actors, people that are in the performing arts community, you know, artists, just artists in general are amazing people and so eclectic and so intelligent and have so many facets to them. I mean, just as all people do, but there's something really special about performers. I really believe that. And we are just such a community. And if you get a group of performers together, it's kind of like they immediately mesh and understand each other and can create something, whether, they're dancers or singers or actors or, sculptors or painters, whatever they are. It's just there's some type of common magical thread between all of us, that we connect so well. And I think also artists connect really well with people. And if you're good at connecting with people, which you have to be, I think, if you're a performer or you're an artist that you display your work and you're trying to reach people, is you can be you're good at everything. There's so many fields you can get into. You can be a medical professional, you could be a doctor, you could be a politician, you could be, whatever you want. Because I think if you have that baseline, skill of connecting with people, that's what life is about, right? Is connecting with people. That's why COVID's been so hard, I think, for all of us, because we can't connect with each other the way that we're used to connecting with people. So I think that's been, just one of the many challenges of this. And so if you are a dancer or performing artist, just having that realization that you can, do whatever you want to do. There's so many facets to what you can do, and there's so many different jobs and careers that you can have, and just I think being really open to that.
So thank you so much again, Vanessa Figueroa, for joining me today to talk about physical therapy. I also want to give a little shout out and thank you to Robert Sy, who is the other physical therapist that I discussed, who is one of the founders of Dance Prefab. And I really appreciate both of your help in just giving a little bit more about what it is to be a physical therapist, what it means, what it's like, what the experiences are, how it relates to dance, and how one may decide to move along that career path. I really appreciate your taking the time to give insight to that. And join us next time for looking at what the career path is like, or the career in dance, but specializing in being a Broadway performer. We have an exciting guest coming with us, and it's really fun to hear all about what it's like to dance on Broadway. Thank you for joining us.